Hey guys, I'm Nick Sanders, physical therapist with Fit for Function, and today I want to talk to you about naggy kind of low back pain, stuff that you've been dealing with for a while that might sit either right in the middle of your low back or the outside of the hips. That's bothersome with walking for a while or sitting for too long, just kind of that naggy low back pain. Now the first thing we want to do before we mess with any of this is to see if there's any nerve tension related to your back pain. If there's nerve tension or irritation, the way we handle the back pain is going to look a little different. So for the purposes of this video, if there's nerve tension on board, we're going to pivot and say that you should contact us or another health professional to kind of take a little closer look at it. And if there's not nerve tension on board, we're going to mess with some things around the hips and the low back. So first and foremost, as a test, we're just going to look at your forward bend range of motion. So all we're going to do, let your head kind of be heavy, and you're just going to try to curl down one segment at a time and see if you feel any back pain. We're looking for any kind of tension in through the hamstring and in through the butt, and just kind of seeing what we feel there as we hang. If you do feel pain on one side versus the other, that's a little different side versus side, that's a sign that obviously there must be something going on that side. But the next question is it a muscular kind of tightness, a referral kind of a tightness, or is there some nerve tension? One of the quick little ways we can check to see if it's nerve tension is if it changes by tucking your chin. So if I keep my knees perfectly straight, I come all the way down, and I'm just gonna look to see if that tension in the back of my leg changes as my head comes up versus my head comes down. If when you tuck your chin down, the pain gets worse, and as you come up, it gets better, that is one sign that there may be a little bit of nerve tension relating to some of that pain. Now, that's not a perfect test, and if we were in the clinic, we would do some other things, but it's a way to look. And the theory here being, if it's my hamstrings, right? If say it's my hamstring tightness that's keeping me from touching my toes, well, me tucking my chin or straightening my head shouldn't change the length relationship on the hamstring. However, if it's a nerve tension, that nerve's coming out of the, coming from the brain down the spinal cord, comes out of the spinal cord, down the leg, all the way into the foot. So if it's nerve-related tension, well, now moving my head is going to affect that tightness. And so what we're looking at by seeing if the head movements change the pain is, again, to look to see if there's trouble with that nerve excursion as it moves through that sheath, either where it comes out of the spine or somewhere down through the leg where there may be some entrapment points along the way. In that scenario, the way you treat it is going to look a little different than if we're just looking at some restrictions of the spine itself, right? So first and foremost, if you felt some nerve tension with head motions, we want you to go see somebody, let them check that out, see if they can figure out where that nerve tension is coming from. Now, assuming you did not have any change in your symptoms with your head motion, what are some things that you can do to change some of that pain in the low back? So we want to check multiple ranges of motion in the spine. So we've already looked at our toe touch, so we're going to see how that feels, get an idea where you're at from your baseline. Then we're going to do a back bend. We're going to put hands on hips, thumbs are going to go in the small of the back, and I'm just going to lean back and kind of see how that feels. I'm going to go side to side, reaching down towards my knee from side to side, see how we feel there. And then I'm going to bring my feet together and I'm going to twist. Okay? What you're looking for here is if there's any differences from left versus right. Does it feel different when you twist to the right versus when you twist to the left? Differences may come in the form of how far you're able to turn or pain on one side versus the other. Okay? Everything we like to do, we want to test it. We want to try a technique or a treatment option, and then we're going to retest it. So for this video, what we're going to try, we got our test here with our range of motion baseline. What we're going to try to treat it is some releases either with a foam roller or with your Hypervolt, and then we're going to come back and retest the range of motion and see how you feel. All right, so one of the primary causes for just kind of stiff, naggy low back is tightness in through the hips. And so what ends up happening is because our hips get really tight, they pull on our pelvis. So they put the pelvis either in a tilt position or tucked under or tucked forward or whatever it might be, but it changes the position of the pelvis, what ends up putting more stress on the low back. So if it's just naggy kind of tightness in the low back, a lot of times if you improve the range of motion in your hips and improve the pelvic positioning, it actually takes pressure off of the low back. And so what we're going to try here is we're just going to show you some techniques to release the hip, see if it changes any of those range of motion type things that we just tested. Okay, so I have two different tools here. You can use a lacrosse ball or some other things, but these are two of the things that we use most often for our home exercise type programming. First one I have is just a regular old foam roller. There's a million different types of foam rollers out here. This is just a basic dense foam. Also love the Hyper version that adds vibration. Whole nother sensory input, love it. But that's one option. And then the other option is the Hypervolt from Hyper. A lot of you are going to have these massage guns now. They're fantastic, so we're going to show you ways to use both of these tools to release the outside of the hip. We'll see what happens. So the first thing we're going to check, I'm going to roll onto my side a little bit here, and right off the outside of my hip, if I come down right off of my, kind of the top of my back pocket, the front edge of my back pocket, right in here, there's muscles that come off of the hip and attach to the outside of the hip bone that we call the glute med, glute min, as well as your glute max is going to run through there. These things, because we sit with our knees turned out all day long, these things tend to get in a shortened position, a guarded position, and it's one of the things that can affect our pelvic posture. So what I'm going to do is I'm going to take my foam roller, and I'm just going to sit on the roller. Nothing real fancy here. I'm going to sit on the roller. I'm going to rotate to the side just a little bit until I hit that spot where I feel that same tension on the outside of the hip. Again, I'm behind the hip bone, about where my back pocket would be, okay? As I move around, I'm looking for a tender spot, and I have one right there. I can find a tender spot there. And now I'm gonna do a technique that I call pin and stretch. So I'm gonna pin it by just putting pressure on it. So I'm literally just looking for that tender area. I searched, I found it, pin it down, okay? Now that I have that tender spot, I'm gonna stay there. I'm not gonna change my pressure. I'm gonna leave it right on there. I'm looking for an intensity that's maybe a 5 out of 10. Right? If I want more, I just put more body weight. If I want less, I take body weight off, right? So I'm gonna leave some weight on there. I've pinned it. Now I wanna stretch it. My favorite way to stretch it is I'm gonna pull this knee across midline just a little bit. So I'm leaning on that spot. I'm gonna take my bottom knee and I'm gonna pull it across. And I'm just gonna pin, stretch it across. And I'm gonna repeat that for about 30 seconds, right? So I'm just going back and forth about 30 seconds. Then I'm going to move a little bit. I'm not going to go crazy, but I'm just going to hunt around. I'm going to see if I can find another tender area. Okay, there's one that's a little tender as well. And I'm going to do the same thing for 30 seconds. Okay, I'm going to repeat this 3 or 4 times. So I'm going to find 3 or 4 tender spots, move around a little bit, find a tender area and pull. 30 seconds again. Okay, I'm going to do this on both the right side and the left side. After you've done 90 seconds on each side, then you're just going to go ahead and stand back up. You're going to recheck your spinal range of motion. You're going to do that toe touch, the back bend side to side, and a twist, and you're looking to see if there was a change. For a lot of you, if the hips are putting pressure on the low back, this will take some tension off the hips. The range of motion will improve. You're going to enjoy this one. It's something that you can repeat often. In the clinic, right, we'll do this as well as some other manual therapy techniques to kind of get into those areas. But we also want to look at why that's happening. And that's really the long-term outcome. If we can figure out why those hips are feeling tight, make some postural lifestyle adjustments and some strength adjustments to take some tension off there, that's really what's going to give us the long-term relief and what we want to look at. So that's going to be the plan. Reset it with a 90-second release and then go ahead and come back to it. Now, if you want to do the same thing but with the Hypervolt, okay, we're going to target the exact same area. So turn my Hypervolt on the bottom. We got our power setting on the, or our on kind of setting on the back. I'm going to start with the first speed on this Hypervolt. Different massage guns have different settings, but I'm going to start small. But I'm basically looking for the same area. So I'm just going to sit to my side, and we're going to hit that same spot on the outside of the hip. I'm going to scan just like I did by rolling on the roller, find that tender spot and pin it, and I'm going to stretch it across, right? So nothing changes. The beauty of using the Hypervolt here, I'm on the floor because we just got done doing the roller, but boy, you could do this in your office chair at work while you're sitting in the office. Lean over in the chair a little bit, hit the Hypervolt on that spot, pull that knee across, and that's going to be a real nice technique that you can quickly do in the office. So while I love rollers and I love being able to get on the floor and put some body weight through it, this is one that you can do pretty much anywhere, anytime. Look for that spot, hold it for 30 seconds, pull it across, okay? Repeat 3 or 4 times. That's going to give us our 90 seconds to 2-minute treatment effect that we're looking for most things. And that's going to be very effective for you. So Love the Hypervolt. We carry these in the office. Of course, you can buy them online and they're everywhere else, but fantastic product that we use often in clinic, as well as recommend for you guys at home. So either one, roller, Hypervolt, doesn't matter. Release the hips, recheck your range of motion, see if it made a change. If it did, fantastic. That's going to be a good one for you. Next plan is to build some strength and some range of motion in the hips so that thing stays away. We'd be happy to help you with that. Again, fitforfunction.com. Set up a free phone consult, talk with one of our therapists. Let's see if we're a good fit for each other and if something like that makes more sense. Be sure to check out the rest of our YouTube channel. Like, subscribe as we put out more content, more videos. That helps us out, helps us reach more people like you, which is ultimately what we're trying to do.